Lori, this time of year, usually when the weather gets a little nicer, we start worrying about ticks. And, you know, especially if your kids are out on, like, the baseball fields, the soccer fields, spring's here. Many parents need to be aware of the dangers of ticks.
And prevention really is the best approach. And the cold winter months doesn't mean that the ticks went away, contrary to what a lot of people think.
I thought that.
Right?
I thought
Yes.
the cold weather kills the ticks.
Actually, it's just the very opposite.
Oh, no.
Here to help us protect ourselves, understand it a little bit, neurologist and pediatric and adult autoimmune and Lyme disease specialist, Dr. Alana Frid, and also journalist Mary Beth Pfeiffer is here, who wrote Lyme, the first epidemic of climate change. Good morning to you both.
Good morning.
So this time of year, it's bad, right? Because I thought, like, after the winter,
right,
we kill those ticks.
Yeah, ticks don't die. No. They just go to sleep when it's below 0 degrees Celsius, and then they wake up when it gets
so they
a little
become
warmer.
dormant.
Yep.
And then in the springtime or when it gets warmer, they're ready.
Oh, they just go under that layer of snow and they nestle in, and as soon as the temperature hits, say 40 degrees, they come out, which is why, because of the warming climate, we sometimes see them in December and January when we have this little spike in temperature.
Is that some of the basis for your book as well? Because it goes counter to what we know about why you bring up the climate change factor.
Climate change is pushing this disease and these ticks around the planet. It's in many countries now, which is what really surprised me when I did my research. It's every bit as bad in Western Europe, for example, as it is here in the Northeast. It's in China, it's in Australia. These ticks, you know, by the billion are moving around the planet.
Dr. Alana, what do you see in your practice?
Well, interesting that Mary Beth brought this up, because I actually have an international practice, and I have patients from all over the country and all over the world coming in to be treated, because not a lot of physicians actually specialize in Lyme disease. So I actually always advocate to patients to ask whether their physician actually has been trained in Lyme, how many cases have they seen, because a lot of times the testing for Lyme disease can be inaccurate.
Do you have to do it a few times to make sure?
You do have to do it more than once, and sometimes even use specialty lab work. And a lot of the times the presentation of Lyme can be very tricky because it can mimic other diseases. So for example, in children, especially not the acute phase but later on in the disease, if you didn't catch it when you had the headache, the fever, the joint ache, or the body aches, or the rash, the bullseye rash, which is actually quite uncommon. People need to know that. So these kids can present with symptoms of ADD, regressive behavior, changes in their personality, anxiety, depression, OCD, and it can even mimic autism. So it's a very complex disease, and can send you on a path to treat a patient in a completely different way, where they may need to be treated for Lyme.
And it can't be treated for each individual the same way, particularly if it's not diagnosed and it's not treated. It can develop into other symptoms and other real major problems.
Absolutely. So each patient needs to have an individualized approach, and sometimes these ticks can carry more than just Lyme disease.
Like what?
Like other co-infections, for example, Bartonella, Babesia, Ehrlichia, Rocky Mountain spotted fever, viruses that I think you guys have covered on your show before, Powassan virus. So it
and
could
it's
be
lifelong.
Yeah, and it can
Can't get out of your system.
It can be chronic if it's not treated aggressively early on in the disease process.
All right, Mary Beth, you know, kids are getting out there. They're getting ready to play spring sports. What can parents do to ensure that their kids are going to be safe and not come home with a tick?
This is our #1 priority, really. We have to protect our children. I've interviewed parents and guidance counselors who tell me that children have missed months and even years of school and of childhood because of these diseases. Children 5 to 14 are the most frequently infected with Lyme disease, and as we said, it can have debilitating long-term symptoms.
So how do we protect them?
We need to start using some things like, you know, there are school districts in Connecticut, for example, which spray the edges of ball fields and the edges of playgrounds. These are the places where the grass is a little high, a little brushy, and you just rub up against that and you pick up a tick. And these ticks are so small in certain stages of their lives when they're particularly dangerous that you might miss them, you might not see them.
Is there a spray that we can get at the drugstore that helps?
So actually, I've come up with a product called DrFridKidswear. You can find it on DrFrid.com, which is insect repellent clothing for children. They can wear it over or under clothing. It's very effective against tick bites. It's been independently tested, over 93% effective. It's a good option. The other thing I always say is to spray your play area, whether it's schools or your yard, because that's the most common place they'll pick up ticks.
Right.
And finally, protecting your pets, because they can bring in the ticks to your
Yes.
And if you're hugging them like we
My
often
little
do.
Lulu, we get so nervous.
Right.
So, by the way, Mary Beth, happy birthday. Congratulations on the new
Happy
book
birthday.
today.
Thank you,
You got a lot of
Roseanne.
stuff going. And I believe next week you have a big event that you are the honorary chair for.
The Global Lyme Alliance Gala, which raises funds for research into Lyme disease.
Where's that
really
taking place?
Important group in Greenwich, Connecticut.
Tickets still available, do you know?
I think so.
Wonderful.
And
Congratulations.
if you look up the Global Lyme Alliance, they have a lot of good information on their website as well. How can we find you, Mary Beth?
I'm at thefirstepidemic.com for my book.
And what
Dr.
about
Frid?
ElenaFridMD.com. And I have to tell you guys are doing the best job on television and raising awareness for Lyme disease, so thank you very much.
Well, you know,
It needs to be done. It's
yeah.
so serious when you talk about the numbers and the rise.
Yes.
Fourfold.
Yes,
and we
need to
know
be
lots
aware.
of people who
Yeah.
have it, and it's very hard for them to get well.
Yeah.
Thank you so much.
Thank you.
Appreciate the
Thank you for
information.
what you're doing.
All right, Good Day is going to take